Good morning, everybody. My name is Dina Johnson, and I am coming to you from JFK Partners. And welcome to the second in our transition aged um, webinar series. The first took place in February and was about inclusive higher education. And then we have two others after this one today coming up. And you can find that information on the JFK Partners website. So I'd like to first start by introducing our speakers today. We have Melanie Hansbrush, who is curriculum developer and trainer for the Office of Employment First. She entered the world of benefits counseling in 2003 with a benefits counseling certification from the Virginia Commonwealth University. She has since worked to provide Colorado communities, persons with disabilities, their families, and support systems information about the interaction of benefits and employment. With the Colorado Office of Employment First, Melanie is working to improve benefits counseling awareness, service provision, and capacity in the state of Colorado for all persons with disabilities. Melanie believes in the power of knowledge and the right of all individuals to access employment and enhance economic self-sufficiency. So then we have Jennifer Stewart, who is a contractor of the Office of Employment First and the owner of Breaking Expectations, LLC. She has a passion and systematic knowledge of how to support transition-aged youth and young adults navigate both education and the adult systems. She is contracted with the Office of Employment First to support the work with educational entities, families, and young adults around Employment First practices by starting early with high expectations and access to pre-employment opportunities. Jennifer recently relocated to Colorado after spending time in Massachusetts, dedicated to enhancing transition services and work-based learning opportunities for young adults with disabilities. In her last role, she was the statewide transition director of for the Massachusetts Rehabilitation Commission, the state's vocational rehabilitation agency. She led a systematic policy change redefining how pre-employment transition services were administered, which increased opportunities for thousands of students across the state. Jennifer was a Lund Fellow with a master's in public policy from Heller School at Brandeis and has a Bachelor of Arts from the University of Colorado. She has worked with young adults with disabilities for the past 10 years in various capacities by providing vocational counseling, supporting families, developing programming, building system capacity, and evaluating impact. She is happy to be back living in Colorado with her husband, two young children, and a dog where she is now closer to her family and where she grew up. And then we also have Teresa Nguyen. She is from Denver, Colorado, and she identifies as a Vietnamese American woman with a disability, and her pronouns are she, her, hers. Teresa received her Master of Public Health from the University of Colorado Anschutz Medical Campus, and her work is focused around healthcare policies and systems improvement for vulnerable populations. She has experience in both federal and state level health program and policy development, and is currently a curriculum developer and trainer at the Office of Employment First, specializing in youth and families. In her free time, Teresa enjoys cooking and traveling with her dog, Milo. So welcome, speakers. I'll hand it over to you.
Great, thanks, Dina. Good morning, everyone. Thank you for having us. Thank you, JFK, for inviting us to speak with you today. So we're representing the Colorado Office of Employment First, and we're here to talk to you about transition age youth and the importance of high expectations for employment. So we thought we would start out our presentation by just asking this classic question. Were you ever asked as a young adult, what do you want to be when you grow up? Now you could put this in the chat or you could give us a thumbs up. I more want to just prompt you with this question and have you sort of reflect as I ask you, how does this question make you feel? Did you always know the answer to this question when you were asked? And also, how often did that answer change? And I think that's the most important thing that we want to emphasize here is that during sort of these transition years, we're always sort of becoming and evolving, right? We're taking these steps on a journey to discover who we are. And so therefore, the answer to that question should evolve as well. So here you can see I have this graphic of sort of start and a goal, and there's lots of weavings of in and out here because that sort of vision and those expectations of what it is that we want to do when we grow up does change. And so that's how we would sort of start out our presentation today. So who we are, I think Dina already did our biographies. So I want to say hello to everyone. I'm Jennifer Stewart. As Dina said, I'm contracting with the Office of Employment First and working closely with the Department of Education as well as the Division of Vocational Rehabilitation to really align our messaging and training specifically around high expectations for young adults with disabilities around employment. And so this presentation today is quite appropriate, and I'm glad to be here with my colleagues, Teresa and Melanie. So I will let Melanie, do you want to go ahead and introduce yourself?
Hi, everybody. Melanie Hansbrook. Benefits counseling is my specialty as well as a curriculum developer and trainer with the Office of Employment First. And so that's what I'll be talking with you guys about today is everything around benefits counseling. Thanks.
Good morning, everybody. I'm Teresa Nguyen. I'm also a curriculum developer and trainer with the Colorado Office of Employment First. And I specialize in youth and families and our work that is focused on those two populations. Some of that looks like, kind of hosting and facilitating a youth advisory council, looking at closely, what a family's role is in kind of employment preparation and the employment path, and some other exciting things within the office. So thank you so much for joining us. And I guess I can take us into the next slide. So before we start our, kind of talk about the employment path and transition and what that looks like, I wanted to give you a little introduction to what our office is and what we do. So the Colorado Office of Employment First has a vision of creating and embracing a culture of inclusive, meaningful, and competitive employment for all people. And we do this through our mission, which is leading Colorado toward equitable employment, reaching all people with disabilities through collaboration, systems innovation, and training excellence. Next slide, please. So many think that Employment First is a training that you attend or it is a trend that you need to be aware of, but it is a lot more than that. Employment First is a belief and a value that all individuals, regardless of level of disability, are capable of full inclusion and working in competitive integrated employment, or CIE. CIE is the first and preferred outcome, regardless of level of disability, in businesses found in the community with regular compensation, equal advancement, and equal interaction and integration with non-disabled coworkers. Employment First is really a systems change and a culture shift with efforts in state agencies and employment-related policies, service delivery practices, and alignment of service funding structures to increase these CIE outcomes. Next slide, please. So why is this important? It's important because when we look at kind of the employment rates of folks with disabilities, it is particularly high when it comes to unemployed or underemployed individuals. The National Core Indicators states that nearly 85% of individuals with significant disabilities are unemployed or underemployed. And in addition, the IPS Employment Center has found that 65% of individuals with significant mental illness want to work, but only 2% have access to an evidence-based supported employment program. And so this is, you know, kind of a little level of social determinant of health that we wanted to tackle as an office, because these rates are fairly outstanding and significant for the population of folks with disabilities. Next slide. And again, I wanted to further demonstrate that point that the employment participation rate is lower between folks with disabilities and folks who don't have disabilities. According to the Institute of Community Inclusion at the University of Boston, Massachusetts, the participation rate of people with disabilities in employment is much lower. Again, it breaks it down into several different types of disability. Cognitive disability and their participation rate at 15%. Folks with a mental disability participate in employment at 25%. And then really any disability still falls at 34% of participating in employment. And when we look at the bottom number, that's the percentage that folks without disabilities participate in employment. And so at 80%, that's much higher than those three numbers that we were just talking about. And this is after nearly 30 years since the inception of the Americans with Disabilities Act. And so our office is dedicated to kind of focusing our efforts in supporting all people with disabilities, including the transitioning youth and their families in obtaining opportunities in CIE. The more students and transition-aged youth that are going to work can really be a step in the right direction to change this data and improve employment outcomes for people with disabilities and their quality of life. Next slide, please. So that's our office in a nutshell. Some things that you all would want to check out later would be our website. We host a variety of resources on this website, and you'll find some previous recordings of webinars and trainings that have been hosted by our office. Please check out our social media pages and interact with us. We love engaging with the community through those channels. And then lastly, we are hosting our very first Colorado Office of Employment conference, Employment First Conference, this summer. So save the date for June 9th through 11th of this year. It will be a virtual conference. And the theme is Building Leaders in Employment First. Again, covering all ranges of leadership, including those with individuals with disabilities and their families. Next slide, please. So I wanted to kind of frame employment a little bit better in the social determinant of health concept so that we understand why it is so important to the well-being and the health of every individual to be able to work. So social determinants of health are conditions in the environment in which people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. And so as you can see here, economic stability is one facet of the entire gamut of social determinants of health. And and it does contribute greatly to somebody's well-being and health. Next slide, please. So as many Americans are either working or looking for work, there are many aspects of employment that affect health. And, you can see here that unemployment can have negative health consequences. Data shows that those who are unemployed report feelings of depression, anxiety, low self-esteem, and demoralization. Unemployed individuals tend to suffer more from stress-related illnesses, such as high blood pressure, stroke, heart attack, heart disease, and arthritis. In addition, job benefits, such as health insurance, paid sick leave, and parental leave can affect the health of the employed individual. And lastly, periods of economic recession are possibly associated with the higher prevalence of mental health and substance use disorders and other physical health concerns, which makes employment a protective factor to all of these risks and illnesses that an individual may experience, which really brings us to the point of, focusing on these individuals with disabilities and their employment outcomes, because we know that the systems intersect and do impact each other, but can't really impact, health and wellness on their own. And so integrated kind of the distinction between how employment can contribute to health kind of helps us frame a lot of our work. Next slide, please. So just another data slide on how employment reduced healthcare costs. Medicaid costs were reduced by $161 per member per month, according to data, when they were engaged in an employment support program. And again, employment really kind of contributes to that greater health equity for folks with disabilities, which is why we're talking about it today. Next slide, please. So today we'll be focusing on transition, but really through the lens of employment and what that looks like when you are getting ready to prepare for adulthood and work. So that's what we'll be talking about today, even though we do know that transition is a big process and it involves many pieces and systems that often work together. Next slide. So today's agenda, we'll be going over, what is transition? What do high expectations look like? We'll talk about pre-employment transition services, benefits counseling, and community connections and partnerships. And with that, I'm going to hand it over to Jennifer to talk about transition.
Great, thank you, Teresa. All right, so what is transition? So I'm going to talk about it in sort of a big picture way. It can be both a plan and a process, right? So during sort of these transition age years, what we often talk about during high school, but I like to also talk about the fact that it's happening before high school and even occurs after one leaves school. It's really about a planning process, right? So a plan put in place specific to a young adult's vision. So a very person-centered, what is their vision? What are they interested in? What is their skill set? And having a plan be put in place related to that vision. So that's one aspect of transition. Transition planning is a key component to really helping to meet those expectations. So we have a planning process, and then because we have a nice plan in place, we're going to have a process that's happening during and before the high school years to really work on gaining those skills and having the experiences to best prepare that individual to be successful when they do leave high school. So the planning and the process really go hand in hand. We want to have experiences to enhance those skills related to whatever the plan in place is. So I'm going to be talking more about all of these different planning aspects in the next couple slides. Also very important during this time of transition, this is really an important time to be practicing self-determination, right? So having young adults be put into situations where they're making decisions, they're problem solving. We're really allowing them to discover sort of their interests and strengths and areas of needed support. To really, as I had sort of started out the presentation, sort of discover who they are during these high school years to be prepared for when they leave high school. So one of the things about transition, as I was saying, is there's not necessarily one place that it takes place, where transition planning takes place. So it sort of is that question, well, who's responsible for transition and transition planning? So as I said, sort of my first bullet here is number one, this is a process that's occurring throughout sort of a young adult's high school years. And I have here sort of less than 14, right? So even before high school, how is this process sort of evolving, and the conversations of what life should look like after one leaves school. But even afterwards, right? Everything might not be set up as soon as somebody exits the school system. So how do we have sort of those ongoing conversations? So we sort of have this overarching process, and then we have transition that might be happening in the school system, right? So in the school, starting at age 15, if you're on an IEP, you might be involved in some transition planning and transition services if you are eligible for an IEP. So that's one area that transition planning and services are taking place. Another area would be with pre-employment transition services. So starting at age 15 through the Division of Vocational Rehabilitation, you might have a plan be put into place specific to helping a young adult gain some soft skills around their employment-related interests. So that's one area of planning. We, of course, have sort of planning that happens within the family unit, right? So there's family support throughout an individual's lifetime where that family is hopefully planning and helping to encourage self-determination for that young adult and promoting their independence. We might have planning around transition taking place if you're eligible for a Medicaid waiver, where you might be working with a community center board to receive some transition services or family support specific to transition there if you're eligible for that. And then, of course, we also have healthcare transition, right? So we have whole medical teams that support young adults related to their safety and their health. But as I'm saying, with all of these things, there's not one plan or one person responsible for all of this transition planning. And so I like to talk about transition in this big overarching way, just to sort of highlight the fact that it is a complicated time and process of how do we unify the services and systems that a young adult is engaged in and really allow that to support their vision for what it is that they want. And it doesn't happen in sort of these siloed planning processes. And so that's why I want to talk about sort of the importance of family here, right? As you think about that slide I just showed and all of these different things that might be happening in a young adult's life during their high school years, the importance of family and what their role is as really being maybe a unifying factor of bringing all of that planning together, right? So what role can a family have? So families can act as facilitators during this time. So as I just said, right, they could facilitate what's happening in the school. They're aware of the IEP services, and maybe they're going to be able to help facilitate some conversations in alignment with the Division of Vocational Rehabilitation. Families might be working as skill builders, right? So promoting their young adults' self-determination or providing them with experiences and opportunities in the community to build their skills in an area of their interests, right? So setting up volunteering opportunities for them, right? The next one here I say is networkers, right? So they're gonna network with their neighbors or their local church, and they might be able to find their young adult an internship or volunteer opportunity or even an informational interview. So the family has a key role of maybe being a networker to support their young adult along their transition journey. They help to organize. They can organize all of the the, communication, transportation, and then along with that, they're going to support their young adults' vision and self-determination, that ultimately they want their young adult to start promoting their own sort of organization of their vision. So the importance of family is something that we wanted to bring up, as it greatly relates to also the importance of high expectations, which I want to talk about next. So high expectations. So this is from Eric Carter. He comes from Vanderbilt University, and he found actually that the best predictor of post-school outcomes are both parental and teachers' expectations, because it's actually expectations can change the path of what experiences are made available and what is taught to a child or student. So just think about how the expectation, if you're sitting at an IEP meeting, what are we talking about? And we need to make sure that employment is that expectation that is a part of the student's plan. When we have employment as a part of the expectation in a student's plan, or a part of the conversation, even a younger age, then we're going to allow experiences and opportunities for them to move towards employment or whatever that higher expectation is. So you can see how also a teacher's role would be crucial there, as well as a parent, is what are we talking to our young adults about from an early age? So what do we need to do? So we really need to have these discussions early, right? So it's starting in elementary school. How are parents and teachers discussing employment as a goal? It sort of goes back to that question, were you ever asked as a young adult what you want to be when you grow up? That promotes a visioning that we were suggesting we want you to be thinking about it. And even just having those conversations and understanding that that's an evolving process is fantastic. And then we move along and we think about, well, what's happening in middle school to promote sort of still having those high expectations. And so we're going to increase their independence. We're going to increase their setting them up to really start some skill building, right? So maybe doing some chores, discussing potential work experiences that could start to happen in the community. And then, of course, in high school, that's where we're really having those experiences. We're engaging with the Division of Vocational Rehabilitation for pre-employment transition services. We're starting to connect to a benefits counselor so we can do some benefits planning about how the interaction of Social Security is going to work with employment. So these are some of the things that are happening along this trajectory, even for a younger adult, or sorry, a younger child. At a young age, we want to start these discussions. And so along with sort of the discussions of high expectations, also come the actions. And so with high expectations, we also need to recognize that we need to be promoting self-determination. And what that really looks like is that we're needing to fade sort of the supports and supervision to allow a young adult to really have more independence, right? So to be solving problems on their own, to be making choices. And so really having, whether it be the parent's role or having those discussions with the school system as to how a paraprofessional or whoever might be supporting them in the school might sort of take away one of the supports, especially as they're getting older. Right, we also want to promote instruction in the community specific to the development of a skill, right? And the goal of really being independent in the community is a way also to practice and promote self-determination. And ultimately, again, this is all driven by person-centered planning, really making sure that the actions that we're taking related to promoting independence is related to what is that individual interested in, and where do they want to be once they leave high school. So I sort of like this graphic or way of thinking, right? So what I'm really talking about is that we're going to be having this shift in our thinking, especially when we're talking about employment, okay? So our shift in our thinking, so the shift in our thinking, let's say just around the timing, right? So maybe it used to be, we're not going to talk about employment until 2 years before, or once somebody leaves school, we're going to start talking about employment. Well, we want to have this shift in thinking that no, we're going to start talking about employment when they're young, right? So we're shifting there. We're now going to talk about it when they're young. There's a shift in thinking about personal skills, right? So maybe it used to be about readiness, right? So you need to master your ADLs, so activities of daily living, before thinking about work, right? So they're not ready because they haven't mastered their activities of daily living. Well, now we want to shift and say, actually, work can be a place where you're going to master your activities of daily living. Then we're going to have this shift around sort of academics, right? So an old maybe way of thinking is, well, school is just for academics, right? The IEP is filled with, academic related IEP goals. Well, no, we want to shift and say employment really needs to be integrated into the IEP process, and that school is a place for students to develop these work-related skills. So that's a shift there. And then also with the job training that happens during school, right? So maybe old thinking would be just a traditional school-based type training. We really want to move to thinking about integrated and community-based opportunities. And so that's going to lead me to talk about the importance of sort of pre-employment transition services and how school systems can now really partner with service providers providing these pre-employment transition services. So this is sort of this game changer in my mind. And, as you were hearing in my bio, I used to this used to be my world. I worked for the state VR system in Massachusetts. And so we, redid our whole model for pre-employment transition services. And so that's why I'm passionate about, I think, the impact that it can have, specifically with the partnership of families and schools, because we now have a service provider. We have these services, additional services to support students get ready for employment. So it's super exciting. So this all sort of stems from, just in case people are not aware of pre-employment transition services, the Workforce Innovation Opportunity Act of 2014. So it's not new, but in some ways it is still new, because all states, in some ways, are still figuring out a truly effective implementation, again, of how do you partner with schools and families to coordinate that transition planning around employment, okay? So what WIOA is saying with pre-employment transition services is they're asking DVR, the Division of Vocational Rehabilitation, to allocate 15% of their budget to provide pre-employment transition services. The goal of these services is to really increase awareness around post-secondary employment and education opportunities. But the goal is also that these are really these light touch services. It's not about job placement. It's about how do we enhance awareness? How do we sort of get students ready and prepared? And how do we provide them exploration type opportunities like work-based learning? So they're really to go hand in hand during the high school years, right? So who is this for? This is for students with disabilities, and they need to be in high school or post-secondary education. So the partnership of schools is inevitable. We have to, that's who's eligible for these services. And it also is for students who are what we would call eligible for VR services. So they've gone through an application process. But what's exciting about this is it's also potentially eligible students, meaning they have a disability, they're likely eligible for vocational rehabilitation, but they don't have to go through the whole application process to access these 5 lighter touch services. So the 5 services that are available for these students are job exploration counseling, counseling for enrollment in post-secondary education, work readiness training, instruction in self-advocacy, and work-based learning opportunities. And I have that one highlighted in a different color just because that's really where the research lies in the effectiveness of supporting students to, achieve actually paid employment once they leave school. Work-based learning could vary from even just job tours and interviews all the way to, of course, paid employment. So as you can see, these 5 services, there's a lot of creativity there for how these services can integrate within the school system to support students during those high school years. So, for me, and I think for all of us, we have to say, oh, well, this is exciting. WIOA, the Workforce Innovation Opportunity Act, has changed the way that we can think about employment for young adults, right? And so we can have this now be this younger focus. With that younger focus comes that high expectation, those early conversations. We now have this shift in really focusing on preparation and soft skills. It's not about readiness. It's not waiting until somebody's exiting the school system. It's really working with them from a young age. As I said, the coordination from every aspect around transition planning is essential. So those are new things that we need to figure out. How do we really integrate plans to support sort of that person-centered vision? And so again, you know, we're not talking about academics versus employment, but we're really at a time where we're able to think about, you know, preparing young adults at the same time that they're in high school for employment. So it's both. So with that, I believe I'm going to pass it over to Melanie here to talk about the importance of benefits counseling, and that also taking place during these high school years at the same time that we're preparing for employment. All right, Melanie.
Thank you, Jennifer, and thank you everyone for listening to me about benefits counseling. If you want, in the reactions, in the bar at the bottom of your screen in the reactions, you can hit a reaction if you've ever even heard of benefits counseling before. I've minimized my screen so I can see everybody. So I'd be interested to see if you've ever even heard of it before. We're trying to get the word out about it. Awesome, getting some couple thumbs up there. So next slide, please. No, well, good, Joe. We'll get that. We'll get it covered. So what is benefits counseling? That's the first thing we got to know. Benefits counseling can be interchanged with the term benefits planning, and you've heard that through this presentation already today. But regardless of what you call it, it's a service that helps people with disabilities, their families, their support systems, truly understand how employment or other life decisions, it will impact their benefits and how all of those interact together. Some of those other life decisions could be things like furthering your education, maybe opening your own business, going into self-employment, maybe taking even training classes to increase your skill set for employment. All of those things can be discussed around how they interact with your benefits. And when we talk about benefits counseling, it's important to know what benefits we're talking about, because I think we can look at benefits in a few different ways. But when it comes to benefits counseling, we're talking about programs. Probably the two biggest ones that we hear the most are SSDI and SSI. And that's SSDI is an acronym, of course. We like acronyms in benefits counseling. And that's Social Security Disability Insurance. And then SSI is Supplemental Security Income. Those are, like I said, probably the two big ones, to put it short. A few other ones, and this is not an all-inclusive list. These are just a couple of examples. There are SNAP benefits, yet another acronym, also known as food stamps, Medicare, which is a health coverage. And then we have all different kinds of Medicaid access in Colorado. And so Medicaid can be discussed as well. Next slide, please. So benefits are important. You know, Teresa talked with you guys about how work is a social determinant of health. Benefits also support health. And so they are a very important piece to talk about if someone's going to pursue that work. Benefits often provide what we call in the biz as basic needs: food, clothing, and shelter. SSI and SSDI, those two big ones, provide monthly cash payments and access to health coverage. And sometimes health coverage is the most important piece to a person's benefit scenario. Because benefits provide those basic needs, it means some economic stability. It also means mental and physical well-being. And then you get benefit programs like I mentioned, there's lots of different kinds of Medicaid. Well, Medicaid waivers have been mentioned already in our presentation today too. The Medicaid waivers provide specialized services that really support an individual with being living integrated in their communities. And so they're all super important. So that's why benefits counseling is important. if someone's going to consider work. Next slide, please. And why work? If someone's got that economic, that stability that they feel when they have benefits, then why work? And it's because work, whether it's paid or unpaid, is good for our health and well-being. Teresa covered that already. Work contributes to happiness, confidence, self-esteem. I work to have money in my bank account. If you work for a specific reason, you can put that in the chat. If it's because you like to eat out or because you like to, pay your mortgage, things like that. We all work for various reasons, and everybody, regardless of disability, should have that opportunity. People that stay just on benefits live in poverty. It's as simple as that. And so even though that economic stability is tied, that the feeling of economic stability is tied to benefits, people that live just on benefits do live in poverty. So that's another great reason to support work. Next slide, please. So how does benefits counseling mix into all of this? Benefits counseling takes all of that stuff and jumbles it together and comes out with a clear and personalized plan for the individual that addresses their benefit scenario, each benefit that they're on, whether they're on one benefit or on 6 benefits. And they put it into a clear personalized plan that explains how their work goal or how their education goal, how whatever their plan is related to employment, how that fits into the benefit scenario and how all of those programs interact. Doing that helps address the fears and concerns that individuals have about those support systems. And if they work and there's a fear of a reduction in benefits or a loss of benefits if they work or make those other life decisions, and then what if they don't work out or what if they change their mind, those types of things. Benefits counseling writes that plan that addresses those fears and concerns. And those fears and concerns are real and they're justified. Whether someone is on 1 benefit or 6 benefits or 4 or 8, whatever it is, it wasn't easy to get that benefit. There was no just a click of a button. There was no simple application process. If it was government funded, it was a long process. It was probably confusing. And if it's in terms of SSI or SSDI, there could have been appeals and long wait periods. And also with those benefits is it's really, pressed into your head that you can't work when you go through this process. So benefits counseling addresses that in a way that helps reduce those fears. Ultimately, all of that really supports individuals with being able to truly have informed choice, not rely on the rumors and misconceptions that are out there that they hear from other colleagues, other families, other people that they know, their friends. It's really truly informed choice because benefits counselors are up to date and knowledgeable or know how to find out the information when they meet with someone. Next slide, please. So the way that benefits counseling works and developing that plan helps address those fears. First, a benefits counselor does a verification of benefits. I've been doing benefits counseling for a long time, and I would say 90% of the people that I have ever met with are mistaken about at least one of the benefits that they're on, whether it's by name or by amount or by how they qualified for it. So it's super important for a benefits counselor to go in and verify benefits straight from the source, from the agency that administers the benefits. And that's the first step. Got to start off on the right foot. Long-term support can be provided by a benefits counselor. That need is determined based on the scenario, based on a person's employment plan, where they're at, the process they're going through, but long-term support is available. Also, assistance with understanding complicated benefit scenarios. Again, in my career, I've seen a lot of things that are occurring with a person's benefits that I've had to scratch my head at too, and then kind of help unravel. And benefits counselors can help with those complicated scenarios that happen. Most importantly, and probably most to the point with work, is how that work goal is going to affect each benefit and how earnings will influence their full picture. And then another common thing is wage reporting responsibilities. There's a lot of misconceptions out there about, well, hey, if I'm working, the IRS reports that I'm working. Well, yeah, they do report it, but they don't report it immediately to Social Security and any other agency. So there are wage reporting responsibilities as well. So that's just a few ways that benefits counseling helps, especially in writing that report. Not an all-inclusive list, but just some of the key ways. So next slide, please. So how can you help a benefits counselor if you meet with one? Well, when you meet with one, I don't want an if, I want a when. If you're supporting someone when they meet with a benefits counselor. If you have copies of benefit verifications from the source that are recent, pass those off to your benefits counselor, share those with them, it saves time. And of course, creating a team approach is also very beneficial. There's just no way around it. The information around benefits is always complicated. There's acronyms left and right all over the place. There's interactions that are scary. And Social Security alone sends out letters that are terribly confusing. And so just having one person have to understand that from the information they receive from a benefits counselor, it can be enough, but it doesn't have to be. If there's a team or a support system, family, that everybody can work together to understand that information and help support a person that's pursuing work, then that's the better approach. And with that, that team can also write down questions that can help you understand, help your son, your daughter, the person that you're supporting, any job seeker understand. If you have questions, write them down, bring them to a benefits counselor, and they can help address those. Developing an organizational system for paperwork that promotes success is another tip. I have met with people that have come in with a long garbage bag full of paper. That's one way to keep paperwork that is beneficial. Maybe not the most organized, but you can work on an organizational system or help your benefits counselors support that as well. They'll provide you with ideas. And then most importantly, be open, be honest, and ask questions. One thing that happens with sometimes with benefits counselors is people will come in and they won't tell the full story because they think that you're tied to the agencies of the benefit programs or to the Social Security Administration, and that you're going to report them for talking to you. And that's just not what happens. There's not a certified benefits counselor in our state that is required to report anybody. And so that just doesn't happen. So be prepared to be honest and open, and then of course, ask those questions. Next slide, please. So some conversations that you might have with your benefits counselor, this isn't going to be an all-inclusive list either. You can always write down the questions that you have, and they could be outside of these 4 examples. But first, how is my choice in employment going to affect my SSI, my SSDI, my food stamps, my Medicaid waiver, my housing assistance, whatever programs that you receive or the person that you support receives? How is that going to affect me now? And then how is that going to affect me in the future? What's that going to look like over the long term? What happens if I'm on a childhood disability benefit and a parent retires or becomes disabled or they pass away? Then what's going to happen to my benefit? How can that change? Will that change? Those are all questions a benefits counselor can help you with. And then probably one of the most common as well is, can I work part-time? Can I work full-time? What does that look like? Can we compare the two? Can I go to school before I go to work? Does Social Security care about that? Does Department of Human Services care about that? Those are all discussions that you can have with your benefits counselor to learn about the interaction of whatever your career goal is with your benefits. And then for transition age youth, we're talking about transition, but Social Security also has a transition. I'll put that in air quotes if you can see me on the screen. Because a person that is under the age of 18 will transition at age 18 when it comes strictly to their Social Security benefits, or they could. So Those are just a common thing to talk about for transition age youth too. Again, not an all-inclusive list of questions, but just an idea, some ideas to get those ideas sparked for you to write down questions for when you go see a benefits counselor. Next slide, please. So when do you access benefits counseling? You don't even have to read everything on this slide. You can just think, if employment's part of the conversation, benefits counseling should be a part of the conversation. Simple as that. And that's if someone is on benefits, regardless of the benefit scenario as well. Transition age students, age 14 to 24, super, super important. Social Security actually kind of tags that group of people as a super important group of people to access benefits counseling. Now also, before you seek employment or education, learn about how that fits. While you're searching for work, upon finding work, and then even if you're currently working and changes occur, if a pandemic hits and you're laid off from your job, or you're asked to work more hours because you work in an essential field, like those are all reasons to have benefits counseling, or have a benefits counselor, I should say, talk with you about those transitions and those changes and what that's going to look like, how to map all of that out. Next slide, please. So if you're a little overwhelmed, even from just however long I've been talking, about 15, 20 minutes, don't worry if you feel overwhelmed. That's what benefits counselors are here for. That's what I can help you navigate getting to a benefits counselor. And you don't have to navigate these systems alone. You know now, hopefully, what benefits counseling is. You know how benefits counselors can help, how they kind of do that. And now how to access benefits counseling. I'm going to give you that in about another slide. And so just as most important, don't have that fear, access the information, use the resources that you'll be provided today, and use the service. Next slide, please. So this is the guide. You'll get that today with today's presentation. It's called a benefits counseling guide. And it identifies all of the certified benefits counselors in Colorado. This slide, it's just a picture of the front page. It's obviously not the whole guide. The guide's probably 4 to 5 pages long at this point, because we keep adding names for certified individuals. But it talks about the basics, even a little bit more than what I've talked with you about today. It talks about what are benefits, what's benefits counseling, when do I seek a benefits counselor, and then how do I access it? How do I pay for it? Who covers what area of the state? How do I access them? It gives everybody's name and contact information. And so you'll have that information today. Now that guide, as I kind of alluded to, is being updated all of the time. And so you can always get the most updated version at the Office of Employment First website, which is listed here. And as soon as we get those updates added, then I go in and update that with the most recent guide. So you'll get a PDF version today, and just remember to check in on the website periodically to see those additional names that we have added. Next slide, please. And then one more resource I always like to plug, because I'm super excited about it, and we're working on it as the lead in the state at the Colorado Office of Employment First, is something called DB 101. It's a web-based employment resource tool and an estimator tool that will be available 24 hours a day, 7 days a week, 365 days a year to explore the world of work and benefits. Someone can say, oh, I receive SSI and it's $700 a month. And I want to find out, I want to be a car mechanic. I want to see if I go earn $700 a month from work, how does all that mix together? There'll be estimator tools available for people to try that. There'll be all kinds of resources and links to the places to go to get information, subject matter experts, websites, links to all kinds of like I said, websites, and people will have the opportunity to just explore work. Now we are planning for the public rollout earlier than we originally had estimated. It'll now be coming early summer of 2021. I don't have an exact date at this point in time, but early summer 2021. So we're just a couple months away, a few months away. And I say there's current opportunities now with DB 101 because we're doing statewide promotional educational trainings about what DB 101 is. So if you're interested, please reach out. My contact information will be at the end of the presentation today. And then we'll also be doing some train the trainer opportunities to help roll out the most effective use of DB 101 and get people to know what it is and to utilize it. So you can contact me whenever you want to find out more information. If you want to check out what DB 101 is, though, there's a website at the bottom. There are 9 other states that have DB 101, and you can check any of those states out. Michigan will be the most close to what we'll have here in Colorado when we roll out. And so I will leave it at that and switch it back over to Teresa to talk about some more community connections and partnerships.
Thank you so much, Melanie. You know, as we've said earlier, you know, transition is a whole process that interacts with many different systems. So we definitely want to talk about what to think about when it comes to the community connections and partnerships piece of transition. Next slide, please. So we've talked about, you know, preparation for employment when you are in school and before school, but what happens when the last day of school comes and the door closes and the bus pulls away? What is next, and what should you be thinking about, and what other systems are folks with disabilities transitioning to? Next slide, please. So this is kind of a very minimal turning 18 checklist that we have here, but you know, most likely, you know, you'll be needing to think about decision making and what that looks like, and having conversations with your partners about that. You'll need to apply for SSI as the logistics change when somebody turns 18. You'll be looking at health benefits, you know, whether that is applying for Medicaid or the Medicaid buy-in program if you're, you know, working or have a job in mind and need to take a look at those options. You'll be looking at, you know, Section 8 housing, if that is an option for you or if that's something you're interested in. Registering to vote, because that's another milestone when you turn 18, is you have that right to vote. You would obtain a Colorado ID if you haven't already done so. And then if you're, you know, a male, you would register for selective service. So those are just some things to think about when you turn 18, but the list is not exhaustive, of course. Next slide. Some other considerations, again, includes adult services, which would include employment in that category. You might want to think about post-secondary options if, you know, education is important to you and if you're interested in that. Traveling and transportation, again, figuring out, you know, how are you going to be able to get to work, to school, to all of the other things that you're going to be doing in adulthood. Looking at housing options, managing benefits, as Melanie has talked about. You look at health and medical care and how that changes as well when you become an adult, and then financial planning. And a resource that I think would be helpful in kind of teasing out these different pieces of transition in this process are your centers for independent living throughout the state. So again, these are organizations that kind of help folks with disabilities at all ages navigate the different systems that they're going to be interacting with, and you know, whether that be applying for benefits or even just learning some independent living skills. And so they kind of help break down this process in a more digestible little process for everybody because it is so intimidating and it does take some time to figure it all out. Next slide, please. When it comes to employment options, you would need to think about whether or not, you're interested in utilizing DVR for job assistance and or job placement services. Consider apprenticeships or internships. Think about supported employment and whether that's something that you are interested in. Customized employment is another option. Self-employment is an option that many folks are interested in nowadays, and especially with our virtual world. And then, of course, ongoing education and training that could help get you to the employment and career path that you're interested in. Next slide, please. So we are going to be wrapping it up and kind of looking back at what we've covered today. Next slide, please. So we've talked about kind of transition planning along with high expectations and pre-employment transition services. And when we kind of integrate all of these planning pieces together, it helps us move towards this, again, CIE or competitive integrated employment that we keep talking about, where folks are in a path that have opportunity for advancement and, of course, where they're integrated within the community alongside their non-disabled peers. Next slide, please. So again, kind of transition planning to achieve employment first always involves a person-centered vision. It involves pre-employment transition services, work-based learning experiences, benefits counseling early on, paid employment options, connection to adult agencies before leaving high school, community safety and access, and then of course, employment in a career pathway. So that is kind of our path to achieving employment first for folks and individuals who are beginning their transition process or right in the middle of it. Next slide, please. So we are going to be ending here and taking your questions in a few minutes, but I did want to remind you of a couple of things before we move on to the question section. Next slide, please. So again, please check our office out on Facebook, on Instagram, on our website itself. You can subscribe to our newsletter and our listserv. That's where you'll be receiving, the most updated training information, webinar information that will be coming out from our office. So please check us out in these medias. Next slide, please. And then lastly, a reminder to just save the date and stay tuned for more information about our first Employment First conference. Again, that's June 9th, 10th, and 11th. And our theme is Building Leaders in Employment First. So next slide, please. Awesome. So I think we've had a couple of questions in the chat that I think we can begin to address, and I encourage you to keep adding those questions into the chat box or unmuting yourselves, whatever works best.
I've got some of the chat questions we could probably jump into while people are typing their questions in, if you guys want.
Great.
All right, and I think the first one's probably for Jennifer. It came from Nicole, and she asked, so does the transition assessment happen at 15 for kids that have an IEP? I'm asking because I have a 13-year-old on an IEP. We had an answer in the chat from Jeffrey who said, yes, it should start the year they turn 15 and continue for the rest of their time in school. But Jennifer, did you want to comment or add anything to that?
Sure, I'll just comment on sort of this overarching term that we use called transition assessment, and that there's not one specific transition assessment, right? So assessments during the transition age years to help and inform sort of IEP goals happen during the high school year. So yes, it should happen before sort of your transition services start. So, you know, when you are a freshman, you're starting high school, you know, what assessments are going to take place in that first year to help inform transition services moving forward. And of course, it should also be tied to what is that student's vision, right? So what is their vision for life after high school? What are they interested in? And then what assessments can take place to help inform learning more about that student. And so a lot of times those might be observational assessments. So it's not necessarily just a academic assessment, but it might be something where we're finding out a little bit about how maybe they're able to sort of interact and engage in the community. So depending on their vision, assessments will take place to help inform when they turn 15 to start transition services.
Awesome, thanks. Our next question was from Liz, and she typed a question for later, so it worked out well. In terms of what opens the door to things like DVR, does disability have to be confirmed by SSA? Is an IEP sufficient? I'll just jump in and say, if you have a Social Security benefit, you've been determined eligible for SSI under SSDI benefits or a Title II benefit, then you're presumed eligible for DVR services. And as far as I'm aware, for the IEP, it would not be sufficient. I think they would still go through a disability process, but Jennifer or Teresa, if you can comment more on that.
I think you nailed it, Melody. I have nothing to add.
Well, and I will just add, what I was speaking about was pre-employment transition services. And so for those services, you actually don't even need to sort of apply and be eligible for VR, right? You just have to be potentially eligible, which does include documentation of your disability. In that case, an IEP is sufficient for that.
Great. And the next one, does SSA still provide benefits planning queries upon request? Is that something you would suggest families collect prior to meeting with a benefits counselor? And Teresa had provided an answer in the chat saying SSI still provides these. However, they are delayed due to the pandemic. It's not required that you have a BPQI before meeting with the benefits counselor, but if you can get a hold of one, that would help the process move along. And I wanted to say that one out loud for everyone in case you missed it in the chat, because that is correct. Benefits planning queries, the acronym for those are BPQY, and they are a very key piece to providing benefits counseling and verifying Social Security administered benefits. It gives a little bit more information than just, hey, this person's on this benefit and this is how much they receive. It gives a little bit more information, some of it related to employment. So it is a query that Social Security can administer. Teresa's right in saying that the pandemic changed everything with how quick those things are sent out. They weren't sent out for the longest time because of the pandemic. And so the benefits counselors in Colorado had to kind of do a workaround through DVR to get some of those queries. But so I guess that's a long, and I'll go off in the weeds on that, but the easiest way to think about it is if you have access, it's always fastest to get it directly to the person that's on the benefit, but your benefits counselor can help you get those with a signed release of information. And they can help go through DVR as well if it's needed. So, but your benefits counselor will help you kind of map that out and work that out. And then Leah had asked, it's until the 22nd birthday, correct? And that was during the turning 18 checklist slide. So I'm not 100% sure which that was in reference to, but if you guys have any idea, or Leah, you can put that in the chat.
Yeah, we have a slide, or that was in the checklist. It was talking about how services through IDEA were in Colorado until your 21st birthday. So some states it is the 22nd birthday. In Colorado, it's 21st.
All right, great, thank you. And then Jenny asked, is there a cost to participate in the conference? There is a cost. I'm not sure what it is. Do we know that?
I don't think we know that at this moment.
Okay.
But there
Yeah,
is
we're in the planning stages. Still save the date. It's gonna be a great conference, and we have a lot of great tracks. I mean, I'll promote that. I hope there's benefits counseling information that'll be in there. Lots of great information. So just save the date. Those details will come out, and then on your screen you can take any one of our information down and reach out to us again or anytime to ask more questions as we know more, as we develop more. So, yeah. And then it looks like, okay. Then Richard had said, I cannot help but think that the higher the minimum wage, the less our kids are going to be employable. Can you discuss? I'm not quite sure the reference. If that's due to benefits, I think the thing to remember is that there's a lot of misconceptions out there around benefits, and a lot of the thinking around benefits is, oh, I have to limit my earnings, and that just may not be the case. There's one misconception is I have to keep $1 in my SSI because I got to keep my Medicaid. That's not an accurate. It's a misconception. It's not an accurate statement. Or I have to limit, if I'm on SSD, I have to limit my earnings to $1,000 a month or I lose my monthly payment. Also not an accurate statement. I would just encourage, if this is related to having a higher minimum wage and having a bigger effect on a benefit scenario, I would really encourage you to meet with a benefits counselor anyways. Maybe you meet with them and they tell you, you know what, it's not in your best financial interest to do this. I'm going to guess that's not the case. I've been doing this a long time and that rarely happens, but there's lots of underutilized work incentive programs offered by the Social Security Administration for one. And there's also programs that the state of Colorado has, like the Medicaid buy-in program that could help address some medical needs, things like that. So just meet with a benefits counselor, get the full picture before thinking that, oh, with minimum wage going up, I can't work. So, and if that's not what you're referring to, then let me know. And then the next comment was, my daughter is turning 14 next year. So it sounds like she can have benefits counseling then. Does benefits counseling cost anything? My daughter only has Medicaid. So yeah, benefits counseling is available. Essentially, it's a free service. Somebody's always paying for it, but it's not you. It's not the person receiving it. It's either DVR is paying for it or the Social Security Administration is paying for it. And so the guide that I showed you earlier that you'll get as a PDF, that will kind of explain who has access where. If a person's just on Medicaid, and that's not tied to SSI, they would meet with a community partner work incentive counselor or a work incentive practitioner. I hate even throwing those terms out there because you're gonna be like, what? I haven't even heard those terms because we didn't talk about those today. But they're mapped out on that guide. And just know that I would say in most cases you're not paying for it. Some agency is, because the importance of the service is recognized. And it looks like just Richard's last comment was, oops, our kids. Oh, that was just a typo. So that's all we have for questions in the chat. If anybody else has anything else, please throw that in the chat. If you have any questions about anything you heard today, we are open to answering those questions or telling you we don't know and we'll find out for you. We can do that too. And Teresa or Jennifer, if you have anything else, please feel free.
Thanks, Melanie. Just thank you, everyone. Thank you for joining us today. I believe this will be recorded, so please share with others that might also find value in hearing this information. So thanks, everybody.
Yes, thank you so
Dina
much.
or Christine? Oh.
Please contact us if you have additional questions. We're always here as a resource.